folks in Hamilton County what they think, and these are the Good morning. Thanks to Jay and Vicki for interpreting for us today. As always, we're going to start with the numbers. As of this morning, the positive cases in Hamilton County stand at 2,228. The delta from Monday, the last time we had a briefing, is 181. We have 426 individuals hospitalized. The change from Monday is 51. And the number of deaths sits at 123. The delta there is 12. We have updated the chart that we had, I believe it was last week. Do we have that for the screen? Is it up? There it is. All right, so again, this gives you an idea of how we're doing in Hamilton County. The blue is positive test, the yellow is hospitalizations, and the red is the death count. And so you can see the trend lines. Now, I'm going to warn you that these numbers can be challenging because sometimes they lag. And Greg will talk about lagging indicators. And so these are snapshots in time, but clearly you can get trends from a chart like this. And so you can see that we are beginning to plateau on the two numbers that we think are the most relevant, which are the hospitalizations and the deaths. The positive cases are responsive to the amount of testing we're doing. And so that is a less great indicator. So anyway, I'll let Greg elaborate. Why would I elaborate when I've got the expert here to talk about this? But I do think that visual, it helps me kind of better understand where we sit in Hamilton County. All right, so as I mentioned, we've got the Health Commissioner, Greg Kesterman, here with us this morning. I've got a couple of announcements As things start to change and open up in the community, I want to make sure that people understand and have some knowledge of what's going on. And this is also responsive to some of the questions that we get in the office. So several of announcements. First, the Ohio Department of Health issued a new health advisory regarding quarantines for people traveling to or returning to Ohio. Previous health advisories required people who had traveled to or returned to Ohio to self-quarantine for 14 days. Yesterday's health advisory lifts overall travel restrictions and the requirement to quarantine if someone travels to or returns to Ohio, adding that unnecessary travel within or outside of Ohio is still not encouraged. Next, an important announcement from the hospitals, and this information is coming from the Health Collaborative. Remember, the Health Collaborative is literally the collaborative of all the hospitals in our area. They can be found at healthcollab.org. healthcollab.org. So effective immediately, hospitals are allowing a patient to have a support person that not only supports them, but also serves as a liaison to the family and the nursing staff. Following are the guidelines for visitors of emergency department and hospitalized patients. Admitted patients may have one support person or family member accompany them. The visitor must remain in the patient's room and contact nursing staff when leaving. Patients are allowed one visitor per day. Visitation hours are from 9 a.m. to 7 p.m. Visitors must be older than 15 years of age. Potential visitors should review the CDC and state health department guidelines if visiting a patient with advanced age and chronic medical conditions, and avoid visiting the hospital if these apply. Patients with suspected or confirmed COVID-19 will not be allowed to have a visitor or a support person. Visitation or support persons for office visits may vary by provider. Patients are encouraged to check with individual providers to ensure that they are clear on their provider's policy. So if you are that support person, visitors must wear a mask at all times. All visitors will be screened for symptoms or exposure history. Visitors will be asked to leave the facility if they have had symptoms in the last 24 hours or exposures in the last 14 days. Visitors must wash their hands or use hand sanitizer before and after leaving rooms and hospital buildings. If you are planning to make a visit to a hospital, please contact the hospital directly or visit their website for more specific restrictions by location. So, this gets to a point that we have made in the past relative to hospitals in general. Hospitals are safe places for those of us that have emergent needs, going in for a surgery, going into the ED. They have relegated the COVID patients to another part of that hospital, so there's no commingling. So they are now starting to open up who can visit folks that are at the hospital for things other than COVID-19. So again, if you have questions, please call the hospital to which you would go, or visit the website, healthcollab.org. All right, we've got some good news about the libraries. So drive-through service will begin on May 26 for facilities that have them. Drive-throughs are located at these particular branches: Covedale, Groesbeck, Harrison, Reading, and the downtown Main Library. Sims does not have a drive-through, but will be offering curbside service beginning on May 26th. Drive-through hours of operation are from 10 a.m. to 9 p.m., Monday through Tuesday, and 10 a.m. to 6 p.m., Wednesday through Saturday. The drive-through is closed on Sundays. Libraries are not accepting books or other materials you have already checked out. They have automatically extended the due dates, so you will not incur any late fees. So that was for drive-throughs. Curbside pickup will begin May 28th. Curbside service will be available at Blue Ash and Loveland starting on May 28th. Call those branches for those hours. Curbside service will be available at these locations starting on June 1st. Jay, I'm sorry about all this. This is going to be challenging here. All right, so Anderson, Clifton, Green Township, North Central, and Walnut Hills. More curbside services to more locations will be added throughout the month of June. They will be posted as dates and locations are firmed up. Again, books or other materials that have already been checked out, do not bring them. There will be no late fees, so keep them until these branches open up. As always, this is again related to the library. The e-branch is always open, and the library is continuing to provide events like story times online on a regular basis. You can still call, email, or chat 7 days a week for help with job searching, finding trusted health information, and getting assistance with a library resource. Thank you to the libraries for providing that information. And so lastly, I wanted to provide an update related to the Small Business Assistance Program. The application went live on Wednesday. It will be open for a week, so through next Wednesday. We've talked about this before, the Small Business Assistance Program. The target is for very small businesses who did not get federal relief through the PPP program. The parameters of that program are on our website, hamiltoncounty.ohio.gov. Scroll down to the bottom of the page. That's where you're going to find the information and the application. So remember, $5 million has been set aside from the CARES Act funding for this purpose. We will expand that if necessary. This is our first time doing this, and so we are not sure what the demand is going to look like, nor do we know how many of the businesses that have applied are going to qualify. And so what we know right now is that 308 businesses have completed the application, 92 are in progress, and most of those businesses have fewer than 10 employees. So I feel as though we are hitting our target here for those that are really kind of on the brink, trying to open up, but they need some relief for rent, for inventory, for employee salaries. That's what this is meant to. It's meant to plug that hole and kind of plug the gap. Remember also that there are different tranches of money. You can either, depending on what you have spent related to COVID-19, dollars are restricted. They have to be relative to a response to COVID-19. So the tranches are $2,500, $5,000, and $10,000. So again, if you need more information, we've gone through some of the details in the past, and so I'm not going to do that again. Please go to our website, hamiltoncounty.ohio.gov, scroll down, and you're going to find all this information in detail and get a better understanding of the program and whether or not the small business that you know of qualifies. Please push this information out. We want to be as helpful as possible. So with that, Greg, we are going to bring up Greg Kesterman. He is the interim commissioner of public health for Hamilton County. And as we open up, Greg is the one that has his finger on the pulse of what is happening out in the community and what the complaints look like and all that kind of stuff. So thanks for being here, Greg.
Thank you, Commissioner Dreihaus, and happy Friday, everyone. There is a lot of change as we are starting to open up Ohio, and a whole bunch of updates with regards to those businesses I'll share. As things change, I really want to encourage everyone to go to two websites. The first is our website, hcph.org, and the second website is coronavirus.ohio.gov. Both of these websites have information that can be helpful for businesses and for citizens as we're kind of transitioning back into opening up Ohio. You know, as we all know, yesterday restaurants were allowed to reopen with inside dining. and we've talked with a lot of restaurant owners regarding their plans for making a safe transition into this new type of service and to get things back to normal. I know they've been very creative and have worked really hard, and that is a telltale sign through the number of complaints we are getting. We are getting very few complaints compared to what I originally thought, and I think that's a great thing. Speaking of complaints, we've had on average 15 complaints per day regarding businesses. And this pertains to all different types of businesses, not just restaurants. We're getting complaints on hardware stores and retail stores as well as restaurants. And we can dive in a little bit more on those types of complaints in a little bit. It is super important still to reemphasize something I've been saying throughout this pandemic, that if you go to a business and you don't feel safe, it is absolutely okay to leave. In fact, the more the businesses are doing things correctly, the safer we will be in Ohio, and the more we'll be able to keep that curve flat. So if you show up to a restaurant and you feel like they've not done a good job, their employees aren't wearing masks, I would strongly encourage you to take your business elsewhere to a business that's doing things correctly. Hopefully this will encourage all businesses to play on the same playing field and to open up safely. Yesterday, the governor announced a couple of additional openings. On May 26th, we know that bowling alleys and mini golf are allowed to open. In addition, another really big one is training for all types of sports is allowed to begin on May 26th. This includes contact sports. At this time, there are no provisions for allowing games for contact sports, but I think getting kids and folks back out training is a great step in the right direction for getting people active again. Another big change announced yesterday was on June 1st, wedding receptions and banquet halls are allowed to begin to reopen. The guidance currently is to follow the same guidance in place for restaurants. In addition, there is a maximum guest level of 300 people, so no more than 300 people in this space. There are still some nuances between the various business regulations as we open things back up. My team is working very hardly to make sure we stay on top of it, and I do encourage, as you have questions, to visit those two websites I shared moments ago. Commissioner Dreihaus spoke briefly on the two requirements from Wednesday regarding some of the stay-at-home orders being lifted. As we know, we are now allowed to go back out. There's no restriction on staying in your house. We are being encouraged still to stay together as families to help reduce the spread of disease. If the family units stay apart or household units stay apart, we do definitely see a spread, less likelihood of spread of disease. In addition, a new guidance document for Ohioans that are elderly and with underlying health conditions was released. And it's really just encouraging us, if we are elderly or have health conditions, to continue to take additional steps to protect yourself and your family. What this means is rely on your sense of personal responsibility and accountability to others. If you're going to a business, you might want to be extra cautious if that business seems crowded. You might want to choose times where the business is less crowded to go there. When you are in locations that are crowded, make sure you're wearing your face mask as well as washing your hands or using hand sanitizer. The second major change that came out on Wednesday deals with interstate travel. As Commissioner Dreihaus just indicated, it is still discouraged, but no longer are you required to stay home for 14 days after that interstate travel. We know COVID-19 is throughout the United States, and that is one of the major reasons why they are making that adjustment. The last item that I'll share is regarding our website. We continue to put a lot of new information up on our website. We continue to make sure that the information is up to date and accurate. We would encourage you to check it out. It's updated daily at 2 p.m. It includes both my jurisdiction as well as the entire county. We also now have a list of known testing sites in Hamilton County on our website. We will keep that list up to date as medical providers give us new information, and it's a great resource to use. With that, I'll turn it back over to you, Commissioner.
All right, thank you, Greg. Really appreciate the information. Bridget, we are open for questions.
All right. Looks like Andrew Setters from Channel 5 has a question for you, Greg.
Good morning, Greg. What would you, with in-person dining opening back up, I know we've talked a lot about this. Go over again your advice to people who are thinking about getting out this weekend and, trying to support some of these restaurants.
Yes, so I am super excited that people are starting to go out and support restaurants and businesses. As I just mentioned, if you are going to one of these locations, it's really important when you're in line or waiting to go into a business that you wear your mask to protect others that are near you. In addition, there's requirements for the restaurant to do the similar types of things to protect your dining party. Anytime you go to a restaurant, as I just indicated, if you feel unsafe, let them know why, and then take your business elsewhere. I would like to see every restaurant make this a safe experience for their diners.
And how concerned are you about this reopening and the potential effects that we could see as we go down the road?
So Commissioner Dreihaus shared at the beginning of the press conference a chart that shows cases. We will be watching that data very closely. We know there is a lag. We know when someone is exposed to COVID-19, it takes a few days for them to get sick, anywhere from 2 to 14 days for that illness to begin. In addition, we know that it takes another probably 2 weeks for them to end up in the hospital and show up in that data. So my team, as well as the team at the state, will be watching this data carefully to make sure that we don't start to see spikes. The big difference this time from when we started going down the pandemic path and changing how we operate in Ohio is at this point we have a lot more PPE, protective equipment, than we did 2 months ago. The state has made many changes and we have new manufacturers and new resources. So we're better positioned for this opening up as we get things going.
All right, that's all I've got, Bridget.
Our next question comes from David Winter with Local 12. I'm going to read his questions. He asks, what are your greatest concerns going into this weekend? And is the health department doing anything special regarding enforcement?
We continue to take complaints via our website, hcph.org, as well as you can call a complaint into our office at 946-7800. As we head into the weekend, we do monitor complaints throughout the weekend, and if we saw a significant issue at a business, we would reach out to them. And I have not yet seen that as I've been watching Ohio reopen. Things have been fairly level with regards to complaints.
Your greatest concern about this weekend?
My greatest concern is that people go out and still realize that the coronavirus or COVID-19 is in the community, and we have to continue to make sure that we are taking the necessary steps. If it's a beautiful weekend and everybody is out enjoying this new opportunity to get out and about, it's just important that we continue to take those same precautions. We've been saying all along there's the need to hand wash and to cover your cough and keep sick at home. We need to do all of those things to keep Ohio safe.
Thank you, Greg. That appears it concludes our questions.
All right.
Thank you. Thanks again, Greg. So I just want to reiterate something because the outdoor dining opened last week, and I did go out. I felt a little uneasy as I drove around and was watching groups of people interact. Look, put your mask on. For yourself and for others, really, it's for others that you're putting the mask on. And if we all wore masks, the transmission of this disease would plummet. And so now I did end up eating at a place that was doing everything right? Tables were distanced. They were serving every other table. The wait staff had masks on. Everybody in the facility that was working there had a mask on. We had masks on other than when we were eating. So there are ways to do this right. And Greg, and remember, Greg's jurisdiction is Hamilton County outside the city. And so there's been a little bit of confusion about this. So the city of Cincinnati has its own health department, and so that is a different point of contact for a restaurant or business inside the city. Greg's jurisdiction is outside the city, other than Norwood and Springdale, who also have their own health departments. The numbers that we report out are collective. They're all those health departments, and when we talk about all the cases, but the enforcement is different. And so the Hamilton County Health Commission has been doing enforcement on complaint-driven basis. And so imagine trying to, that said, if you are a business and you're not sure about if you are in compliance or if you're opening in a safe way, call the health department. They will go out or answer your questions on the phone and make sure that you're compliant. We want everybody to be compliant. So please do that. Anecdotally, I've shared a story. When I opened a business, I called the health department and said, please come out before I open up to make sure I'm doing it right, and they did. So that's a good practice. So, there's a right way and a wrong way to do this, and so we just need to remind ourselves that we are in a time where this could spike again, so we need to do what we need to do individually to keep ourselves and other people safe in the community. So thank you again. By the way, Monday is a holiday, and so we will not have a briefing on Monday. Our briefing next week will take place on Friday, so we'll only have one next week, and that will be Friday. And before we leave, I just want to say miniature golf one more time, because I love this visual. I mean, thank you, Jay. Yes, no, love it. All right, everybody have a good weekend. Thank you.